The danger of megadosing vitamin A in children is a critical issue that demands serious attention, as young bodies are particularly vulnerable to the harmful effects of excessive vitamin A intake. Unlike adults, children's metabolic systems are still developing, and their smaller size means that even moderate overdoses can quickly reach toxic levels with severe consequences. The delicate balance between sufficient vitamin A for growth and immune function and the risk of toxicity is much narrower in children, making careful dosage and medical supervision absolutely essential. One of the most alarming consequences of vitamin A overdose in infants and young children is the swelling of the fontanelle, the soft spot on the baby's head where the skull bones have not yet fused. This bulging is a sign of increased intracranial pressure, a dangerous condition that can indicate brain swelling or other neurological distress. It reflects how vitamin A toxicity can affect the central nervous system in profound and potentially life-threatening ways. Such swelling can lead to severe headaches, irritability, and changes in consciousness, and if left untreated, may cause permanent brain damage or developmental delays. The vulnerability of infants to this symptom underlines how critical it is to avoid unmonitored vitamin A supplementation in this age group. Vomiting is another common and troubling symptom of vitamin A toxicity in children. It not only signals gastrointestinal distress caused by excessive vitamin A, but also leads to dehydration and nutrient imbalances, which can further weaken a child's health. Repeated vomiting in infants and toddlers can be particularly dangerous because it impairs their ability to absorb other essential nutrients needed for growth and immune defense, creating a vicious cycle of malnutrition and vulnerability. More severe cases of vitamin A overdose in children can escalate to neurological symptoms such as lethargy, confusion, and even coma. These outcomes are especially frightening because they can develop rapidly and may require emergency medical intervention. The neurological toxicity stems from vitamin A's effect on brain cells and intracranial pressure, disrupting normal brain function and threatening the child's life. This risk underscores that vitamin A, while necessary for development, can quickly become a poison when consumed in excess. Unfortunately, the risk of megadosing in children is often compounded by misconceptions about supplementation. Parents and caregivers might assume that more is better when it comes to vitamins, or may rely on over-the-counter products without understanding proper dosages or the differences between beta-carotene and preformed vitamin A. This lack of awareness can lead to accidental overdoses, especially since some multivitamins, cod liver oil supplements, or traditional remedies contain concentrated forms of vitamin A. Without clear guidance, well-meaning attempts to boost a child's health can inadvertently cause serious harm. Additionally, vitamin A toxicity in children can be harder to detect early on because initial symptoms such as irritability, fatigue, or mild vomiting might be mistaken for common childhood illnesses or teething discomfort. This can delay diagnosis and treatment, allowing the toxicity to worsen. Health professionals need to maintain a high index of suspicion for vitamin A overdose in children presenting with unexplained neurological or gastrointestinal symptoms, particularly if there is a history of supplementation or dietary intake of vitamin A-rich foods like liver. Medical guidelines strongly emphasize that vitamin A supplementation in children should only be undertaken under the supervision of qualified healthcare providers who can tailor doses to the child's age, weight, and nutritional status. Supplementation is often critical in regions where vitamin A deficiency is widespread and life-threatening, but even in these contexts, dosages must be carefully controlled to avoid tipping the balance toward toxicity. Routine screening and monitoring for signs of overdose are essential components of any supplementation program for children. Moreover, the potential long-term effects of vitamin A megadosing in children remain a concern. Toxicity during critical periods of brain and bone development may have lasting consequences that impact cognitive function, growth patterns, and skeletal health well into adulthood. The full extent of these effects is still being studied, but early evidence suggests that preventing overdose is paramount to safeguarding lifelong health. In light of these serious warnings, public health messaging should focus not only on the dangers of deficiency, but also on the critical risks associated with excessive vitamin A intake in children. Parents, caregivers, and healthcare workers must be educated about the fine line between benefit and harm. Emphasizing food-based sources of vitamin A and promoting awareness about supplement labels and safe dosages can reduce the incidence of accidental toxicity. In summary, vitamin A megadosing in children poses significant and multifaceted dangers, including neurological damage signaled by fontanelle bulging, gastrointestinal distress, and the risk of coma. The delicate physiology of children makes them especially susceptible to overdose, and symptoms can escalate quickly without timely intervention. Because of these risks, vitamin A supplementation in children must always be managed by healthcare professionals who can ensure safe, appropriate dosing. Failure to heed these warnings places children at unnecessary risk of severe, potentially irreversible harm, turning a vital nutrient into a serious health hazard.